Okay, so getting right into it today, we're diving into some pretty heavy stuff, Ebola.
Yeah.
It's back. And this time it's in Kampala, which is Uganda's capital.
Right. And I think this is what makes it particularly concerning.
Yes,
It's the first fatality in the city
exactly.
since that outbreak ended in 2023.
Yeah, and it makes you think, like,
Yeah.
did those containment measures they put in place, did
Hmm.
those really work?
Well, I'm
Like, as well as they thought?
and that's yeah, that's kind of a global question.
It is, it is.
Because if they didn't work there,
Yeah.
how effective are they going to be
Mm,
in other places?
wow.
Right.
Yeah. And it's not just that it's back, but, like, the details are kind of scary, too.
Yeah.
So this nurse, right, he was at Malago Hospital.
Yeah.
This is like the main place in Kampala.
The main referral facility. Yeah.
Exactly.
The biggest one.
Died from Ebola this past Wednesday,
Yeah.
that's really recent.
Very.
Yeah. So, I mean, that's crazy enough as it is. But it also took them a while to diagnose him.
Yeah. That's
They treated him at a couple different places before
Right.
he actually tested positive.
Yeah, I mean, that raises all sorts of red flags.
Yes.
Because, I mean, how many people could he have come into contact with
Right.
during those first couple days when he was experiencing those initial symptoms?
Exactly.
It's, I think the article said at least 44 contacts they're trying to track.
That's a lot.
That's a lot of people,
Just
potentially.
imagine. Oh, just the stress
Yeah.
of being like, wait, am I infected? Am I not?
Exactly.
It's got to be so scary.
Yeah. So just to, take a step back for a second, maybe for some of our listeners who are like, wait, Ebola?
Right. Haven't we dealt with this?
Yeah, like, didn't we already do this?
Yeah.
Why is it so scary? Can you just break that down? Yeah, so Ebola is, well, it's scary because it's a hemorrhagic fever. So basically what that means is it attacks your body's ability to clot blood. So you start, hemorrhaging,
Yeah.
you start bleeding internally, externally. It can be, incredibly dangerous, highly contagious, spreads through contact with bodily fluids. And I think what a lot of people don't realize is that in some outbreaks, the fatality rate can be as high as 90%.
Oh, wow.
Yeah. And the thing that makes it really hard to deal with, especially initially, is that the symptoms are really generic. Like, you get a fever, you get muscle pain, you're vomiting. I mean, a lot of things can cause those symptoms.
Sure.
So it can be really hard to diagnose early on.
Right.
And early diagnosis is obviously key for treatment.
Right.
So it's kind of this stealthy enemy
Yes.
that can spread really quickly before you even know what you're dealing with.
And, I mean, on top of all of this,
Yeah.
the origin is still kind of a mystery.
Right. Like, where did it come from? What is the reservoir for this virus? We still don't really know. I mean, the main theory that most scientists are working with is that it originates from some kind of animal, and then from there it jumps to humans,
Right.
through contact with, an infected animal, or maybe eating undercooked meat from an infected animal or something.
Yeah.
But we still haven't been able to pinpoint that exact source,
Mm-hmm.
which makes it, like, even harder
Right.
to know what to target to prevent outbreaks in the future.
Like finding a needle in a haystack.
Pretty much, yeah.
So, I mean, Uganda's dealt with this before, though. huh?
Right. Sadly, this isn't their first time facing Ebola.
Right.
They had that really devastating outbreak back in 2000
Yeah.
that killed hundreds of people. And then, of course, they were also hit pretty hard during that West African outbreak back in 2014 to 2016, which was, the biggest, deadliest one we've ever seen.
Right. Over 11,000 deaths. It was awful.
It was devastating.
Yeah. But they seem to be reacting really quickly this time.
Yeah.
The Ministry of Health said they have it under control,
Right.
which, I don't know, it feels maybe a little too optimistic given everything that we don't know.
Right.
Like, how can they be so sure?
Well, it's a tough spot to be in, right? Because on the one hand, you need to project confidence.
Yeah.
You need to reassure people, hey, we got this.
Right.
But you also don't want to downplay the seriousness of the situation.
Of course.
And I think in this case, Uganda has learned a lot of hard lessons from past outbreaks.
Yep.
So I think that experience is playing a big role in how they're responding this time around. They probably have better surveillance measures in place now, better control measures.
Mm-hmm.
They've probably upped their lab capacity for testing.
Yeah.
And they're probably doing a lot more to engage with communities
Yeah.
and educate people about what's going on.
Okay, so maybe it's not just blind optimism,
Right.
but it's more like,
More like, yeah, experience combined with caution.
right. But, I mean, it does highlight how vulnerable even well-prepared nations can be.
Absolutely. Yeah,
It's a reminder that this could happen anywhere.
definitely.
And it makes me think, like, what more can we be doing globally to support these countries that are facing these threats?
Well, I think the key is early detection and rapid response. I mean, those are absolutely crucial for containing Ebola.
Yeah.
But that takes resources, right? You need funding for surveillance, for equipment, for training healthcare
That
workers.
came of.
You need funding for public health campaigns to
Yeah.
educate people about what's going on and what to do. So I think the global community really needs to step up its game and
Yes.
provide more consistent, proactive support, not just, reacting when things blow up,
Right.
but actually trying to prevent those things from blowing up in the first place.
Yes, exactly. Because, I mean, let's face it,
Yeah.
it's an interconnected world.
Totally.
So an outbreak anywhere is a potential threat everywhere.
It is, and that's a pretty sobering thought.
It is.
And, it kind of raises a question, I think, for all of us listening, right? Like, what's our responsibility here?
Yeah.
As individuals, what can we do? Whether it's, supporting organizations that are fighting infectious diseases,
Yeah.
staying informed,
Yes.
educating ourselves
Right.
about what's going on with these outbreaks, or even just, good old-fashioned hygiene. I mean, there's a lot of things that
Mhm.
individuals can do, and they all matter.
Every little bit helps.
Every little bit helps, yeah.
Well, on that note,
Yeah.
I think that's our deep dive for today.
Until next time.
Stay safe out there, everyone.
Yeah, be well.